Say no to hormone pellets. Now, I've gotten a couple of comments since I posted my stories. I wanted to explain. These are marketed very heavily to people in perimenopause and menopause. They're basically hormone treatments that are in a pellet and they're inserted under the skin. They contain something like estrogen, progesterone, testosterone. Super important point number one, these are not regulated by the FDA. They have no obligation to prove or show any sort of evidence of effectiveness. They are not standardized in terms of the amount or the safety profiles. And I and pretty much every other gynecologist in the country has had complications for patients coming in with these pellets. I have personally diagnosed people with uterine precancer, clitoral enlargement, voice changes, hair loss, facial hair, because the amounts of, especially testosterone in them, tend to be much higher than is necessary or safe for women. And in terms of cancer risk, if you don't get the estrogen-progesterone ratio right, you can cause uterine cancer. The FDA-approved versions, we know the progesterone is enough to prevent uterine cancer, whereas with the pellets, that's not a guarantee. The second issue is the enormous cost and the financial conflict of interest of the doctors who place them. Pellets can cost hundreds of dollars per placement, and you have to do them every 3 months. So the doctors have a major motivation to get you to take these pellets as opposed to the version that's approved by the FDA that is a few dollars every month because it's covered by your insurance on formulary. These are generic, cheap medications. So those of us who prescribe those make $0 from the pharmaceutical company when we prescribe them, as opposed to those who insert pellets. They're getting hundreds of dollars in profit every time they place them. Now, people say, I love my pellets, I feel so good on them. And I would make the case, you would feel just as good with the FDA-approved versions that have estradiol, progesterone, and then testosterone. There's no FDA-approved version for women, but you can use a men's testosterone gel as FDA-approved for men, so at least as some sort of regulation. And those amounts of testosterone are not nearly enough to cause all of the side effects that the pellets can. And with the men's testosterone gel, it's literally only like $90 for a whole year's supply using a GoodRx coupon card. So for hormone therapy, please see a doctor that follows evidence-based guidelines. You can find one on the menopause.org provider directory for Menopause Society. And if you want to learn more about perimenopause, menopause, hormone therapy, alternatives to hormones, sexual health, etc., it's all in my book. It's not hysteria. It's all presented in a neutral, unbiased way. And you can get it for free in your local library or support your local independent bookstores.